And I would like to welcome everybody to this event of the Michigan State University Science Festival. I'm Roxanne Truen, the coordinator of the festival. And today I am joined by Jonathan Bauer and Emil, is it Eidin?
Eidin,
From the College of Education. And they're going to talk to us about how you build your own pandemic model. A look back at the 1918 influenza pandemic. So take it away.
All righty, let me share my screen and let's go to presenter mode. All right, everybody, welcome. Good morning. Today, we are presenting on how to use the SageModeler modeling tool through the lens of the 1918 pandemic. So, over the past year, you've probably seen and interacted with a lot of models of COVID-19. Of the COVID-19 pandemic. And as these have been shown in many newspapers and countless websites, you're probably sick of seeing these at this point. You know, the old phrase, flatten the curve, flatten the curve. Currently, we're not doing a good job at that, but hopefully it'll get flattened again sometime soon with the vaccines and stuff. However, it's important to understand from a scientific perspective what models actually are and what their limitations are. So, in the scientific community, we often look at models as representations of our knowledge and our understanding at that one point in time. For example, here's a model of how they thought the pandemic was going to proceed early on with the 2-hump model, where they thought, okay, it's going to get really bad. We're going to do some things, flatten the curve. Then, oops, we're going to go ahead, go back up because we're going to open restrictions up too soon. Then it's going to go back down. We're currently on our 3rd hump, by the way, really high with that. So yeah, so this representations, it's also sense-making tools. We use models to make sense of how things are going. So we can look at this model and say, okay, well, if I do this and this, I can actually figure out what's going on. I can know what's doing it. It allows for some predictions. For example, we have the data of the one back in July. We could say, oh, it's going to go down and maybe it'll go up again, so on and so forth. And pandemic models are often used by scientists and governments to inform policy decisions. And it's something that we really need to pay. It can really help them figure out, okay, what policy should we take at one point in time? Now, how much they listen to them? I don't know, but we as the general public, we can listen to them. We can make decisions based on where the model is headed. All righty. And so a little bit of a background on an earlier pandemic. So flashback to the year is 1918. And there is a little bit of a flu that's going around. It actually started in Kansas. It's called the Spanish flu, but it actually started in Kansas in early 1918. It was actually spread at a US military base. But it was first reported in Spain because at that time America was in World War I. We were really afraid of the bad press of say, oh, there's a pandemic going around, so on and so forth. So Spain, who was a neutral country in the war, was the first to actually report it, and they got the bad name Spanish flu. So yes, all those the Spanish flu arguments, they're kind of bad faith, because it really should be called the Kansas flu if we're calling after a place. And it mutated in the European trenches and returned to the United States in a second wave in September 1918. And it's the second wave that was the deadly one. This is where it caused an overreactive immune response amongst young, healthy people, also known as a cytokine storm. So the cytokine storm was young, healthy people with strong immune systems would get really badly sick, and then their bodies would just keep on trying to fight it off harder and harder. And actually, in the process of trying to fight it off, they ended up getting high enough fevers that it actually caused their bodies to shut down. So unlike this current pandemic, which seems to target the elderly more, 1918 targeted the young. And it killed about 600,000 people in the United States and 50 million worldwide, which is more people than in World War I. So this was really devastating. But it wasn't always the same in every single place. So a couple things to keep in mind with this pandemic is this idea of peak death rate versus total death. So if you look at these curves over here on my screen, you can see that overall, the curves represent the deaths of population over a period of time. So the whole area under the curve would be the total death rate. So the total deaths. So the total deaths are the areas under the curve, whereas peak death rate is this little thing at the top. So remember, we're talking about flattening the curve. That's what flattening the curve means. It means reducing the peak death rate, which actually is very important because the higher this peak is, the more hospitals get overwhelmed, the more emergency services get overwhelmed. This is when you get bodies in carts. This is when you get really dark things happening. Versus over here in St. Louis, yeah, you have death, but it's not a high peak death rate. It's more continuous. So therefore you can handle it better. Healthcare systems can adapt. You can have things going on. And a question I have for you guys to ponder is, what was different between these three cities? Why was Boston, Philadelphia, and St. Louis different in terms of their responses to the pandemic? And now I'm going to leave it over to Emil to go on.
Okay. Thanks a bunch, Jonathan. So we'll present you with a free open source tool for creating models, which is SageModeler. I'm going to present some of the affordances of this modeling tool, just to get, so you could get a gist of it. I really invite you to enter the web page of SageModeler, and we can work together on building a model. Wait just a second. So a couple of the affordances that Sage modeling tool allows us is it's quite intuitive. So you don't, many software program models about modeling, they involve entering equations or maybe coding, and SageModeler tries to avoid that, okay, to really decrease the cognitive load of those who are engaging in modeling, so modeling could be more intuitive and inviting for all kinds of people, from elementary school to college students. Okay, yeah, Jonathan. So just to start, I'll share my screen. I hope
I'll stop sharing mine and you can share yours.
I hope I can share mine. You can see that? Yeah, okay, cool. So in advance, I can build my own modeling kind of a base. So it starts with a blank canvas, but I created all kinds of images, those boxes that basically they represent variables. Okay, so I have all those kinds of variables. For lack of time, I would be happy if we could all do this together in a workshops kind of way, but we don't have so much time. So I just create a variable. You create a variable by dragging really, and a variable, you can name it, you can find some images. So I thought about what was available at that time and what were the factors. So let's start with the susceptible population, who can be infected. I thought about the new infected. I thought also about the total infected people. I thought those who unfortunately died from the infection. I thought about the recovered population, and I thought about the virus, how infective it is, and about what they had indisposed to mitigate the spread of the virus, social distancing. So and at the moment I left vaccines out of the picture. Jonathan, if you can only remind me about time, if I'm going over my time, please. So this is the first thing basically you do. You kind of think about the phenomenon. In our case, is the spread of the epidemics of the virus, and you think about the variables or the factors that come into play in this phenomenon. So I kind of try show you what's kind of the thinking process here. Although everyone might have a different kind, but I show you just mine. So I kind of think of the phenomena. I break down the variables that I think take place, and now it's the time to think. Wait, well, how those variables are related to each other. So let's start. The more susceptible people I have, that's where you start making relationships in SageModeler. And the more susceptible people you have, that's the nice thing. And that's, I, I would hope you would appreciate it because, well, I am biased, but I think it's great because it's really, uh, uh, it, it makes it more intuitive. So an increase in susceptible population causes new infected to, I'll say, increase. Like the more susceptible the more susceptible people I have, the more likely I'll have more new infected people. So, and let's say about the same. So here you have all those kinds of options. So you have, first of all, the basic relationship, which whether it causes it to increase or decrease, but then you have like the scale of this change. It changes about the same. And then you have this kind of combination. It's not really you need to put on an equation or make a code of a linear behavior, but you have it already and it's in words. So about the same or a lot will look like this, like a steep curve and then a flat down, a little, just not at a steep curve, more and more. Now we are getting here to exponential behavior, which is research shows it's really difficult for people of all ages, from all kind of backgrounds, to understand and uh, and perceive. So that kind of helps overcome those mathematical understanding. So at the moment I'll put about the same. If the more new infected I have, so I go again to this arrow and I increase, let's say about the same, just for the matter of simplification. Let's say I will assume, of course, that that the total infected, the more total infected I have, so basically that depends on the virus whether the number of recoveries will be a little or about the same, but let's say about the same just for sake of simplicity. And the number of deaths, the more infected I have, so the ratio will be the same. So, and here we have kind of so let's say I got this far, and now I want to test my model just to see how do I know my model works. And here, it's not just by relationship. I have the simulation function. And here I get those mini graphs, right? And I see like the more susceptible I have, the more susceptible population. So everything goes up. And that that makes sense. So I can, let's say the more recovered people I have, I can do like a kind of a feedback, right? The more recovered people I have, like the less susceptible people I have, right? So let's say about the same. So here I kind of create a feedback loop. I can say, depending the how the virus is infective, I can say the more it's infective, so the more the likelihood of new infected people increases. And I can toggle the slide up and down and play with it and see what I get. At the time, okay, they had only basically social distancing. So the more social distancing, here I go to social distancing, and the more social distancing, it decreases the new infected. And this is a good, and if you think about it, that's a very it brings up the argument, wait, whether it decreases it about the same or maybe more and more. Maybe there's a level of social distancing that, or sorry, uh, 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 sorry, more and more. Maybe there's a level of social distancing that to a certain point, it doesn't matter how social distance, how much social distancing you have. So whether as you increase the social distancing, that will go to infinity. So that's a good question, and it's a but for the sake of simplicity, let's say about the safe. Well, I'm personally not sure about that. And this is how our model works. But I can see only direct relationships, right, between variables, but let's see, I want to test how let's say the relation, okay, let's say between social distancing and the total number of infected people. Okay, so to do that, I can create a graph. Yeah, sorry, my internet is pretty slow. I don't know why, but let's say I can create a graph, and I can show the relationship between the two. So let's say my dependent variable will be the total of infected. Wait. And I can drag. There are many ways you can do that. And here, and on the y-axis, the total of. So yeah. So here I created a graph, but how do I record this graph? So I can record it. Let's start with no social distancing, and I can go here to record, and I go up, I go down, I go up, I go down, I go up. Okay, let's say people are actually listening to the guidelines and keep social distancing. Okay, and then I get this graph, okay, that shows me the relationship between the social distancing and the number of total infected people in my population. So I can show the relationship basically between two distant variables, okay, which here we get kind of a to system thinking, like how from the relationship of bits of variables, each pair of variables, I have kind of a emergent property, emergent behavior of my system. This is what we call a static model. It gives you a snapshot in time. Jonathan,
we have 10 minutes left in total, and I want to give a couple minutes for questioning. So
okay, so I just want you to show you just one bit of, I think, the greatest thing about SageModeler, which is not the static model, but the dynamic model, which I have prepared here in advance. It's also about vaccination, and that allows you not a snapshot in time, but to see changes over time, which is real system thinking. And here we can see this kind of model allows you to simulate and predict changes over time, which is the great power of models. I won't get, of course, because of time, to the nuts and bolts of how you build those kind of models, but you can see it can really show you exponential kind of behaviors, exponential decay, exponential increase, which is really a great struggle for many people, and can help in represent those kind of complex ideas in a rather kind of more intuitive, friendly way.
Yeah,
that's it. Thanks. The floor is yours, right. Jonathan. I'll stop sharing.
All right. So one last thing before we end this discussion. So Well, you also can put in real world data into SageModeler, which we're not going to show that today because we don't really have time to. But in this case, we can look at real world data and compare that to our models. And then if our models do not match the real world data, we can change our models. And this is why models constantly change. As we get new information, as the CDC finds new information about corona or about any other virus, they can change the model to reflect the new understanding. So in this case, we found that there is a correlation between peak death and NPI, which is non-pharmaceutical interventions. So it looks like from the 1918 pandemic that aggressive health measures did tend to flatten the curve. And the reason why the data set doesn't go after individual public health measures was because there actually is a lot of, most cities either went all in or didn't go in at all. So going back to Boston versus Philadelphia versus St. Louis and why they were different. So Boston was very unfortunate. They were the patient zero of the second wave. So remember how it started in Kansas? It went from Kansas to Europe, and then it came back stronger than before, and it came back to Boston first. So they really had no time to repair, which is why they had a really high curve. Philadelphia, however, they're a little bit away from Boston. They had some time to repair. But you know what they did? They decided to have a war bond parade, a massive parade overseen here of just people trying to raise up support for the war, getting funding and stuff. They ignored public health things. And within 2 weeks later, here is Philadelphia. 20,000 dead in 3 weeks and mass graves in the city because they ignored the warnings. And St. Louis, on the other hand, with its very flat curve, put in good, strict social distancing policies. They kept up for a while, banned many gatherings for about 2 months. The problem was that they lifted the guidelines a little bit too quickly. And then they experienced a second wave. Now, granted, it wasn't as bad as what Philadelphia or Boston. They didn't have the same peak death rate, but they did experience the second wave because they lifted things up too soon. So I'm going to open the floor to questioning by anyone. The audience, I'm going to give them,
Yeah, so if you have any questions for Jonathan and Emil, you can type them into the Q&A if you're listening via Zoom webinar, and if you're on watching by Facebook, you can put it in the comments section. So we'll give you a few minutes to type if you want to type a question. So is this SageModeler open to everyone to use?
Yes, it is a free open source website, and we actually do bundle it with certain curriculum, but it is free for the general public to use.
Awesome. And are students like in high school learning how to use this system?
Yes, we're teaching it. It's mostly focusing on high school now. We have plans to move it down to middle school, but that is just something we haven't done that directly yet, but we have definitely worked on in high school. We've seen students do very well in high school with it.
And we also have even some teachers who implemented it in elementary. But again, there are many levels of complexity to SageModeler, so that you can really walk across levels and different populations.
Yeah.
I'm just wondering if our agriculture friends could use it for mapping, like if I use this fertilizer and plant these seeds and I grow at this rate, can you model pretty much anything? It doesn't have to be healthcare related. You can
you can pretty much put whatever you want in it. Now, it's a model. It's more about how we think about things. So therefore, you have to compare it to real world data to validate it.
Okay.
So it's more so a way you can map out your thinking and map out your ways of knowing.
Yeah.
Awesome.
Yeah.
I know you just presented on the 1918 pandemic. Have you looked at any other major events that have happened in the US or the world for that matter?
We do have one particular curriculum that's on climate change that we've been working with. Not me personally, but I know that some of my colleagues have been working on a climate change curriculum.
Oh, awesome.
So yes, we are doing some things like that.
Yeah, and also we have like a predator prey. and you can show like the relationship between different trophic levels. So also you can model that.
Yeah, and we can even do it for like more mundane things. So like, for example, one of the units I've been working on is evaporative cooling, which is why do I feel colder when I get out of the shower as water evaporates off me. So we're really modeling how the energy is transferring off and how that evaporation rate is slowing down over time as there's less energy.
Yeah.
Interesting.
Yeah.
And maybe for some of our young attendees out there, I always like to ask our presenters how you got interested in studying what you're studying, to give them ideas of maybe career choices or paths they could take.
So I started off in the science world. Actually, I was a microbiologist myself at one point in my life in terms of, in my undergrad and early on my master's. But then I kind of really got interested in teaching as a TA. And so I got more into science education and how do students learn and how can we make learning better? And really got fascinated by the next generation of science standards, about argumentation, and that led me into modeling, which led me into SageModeler. So it's a really roundabout path that got me here. I don't know Emil's story entirely, but yeah.
For me, I think I when I was 15, we were all friends from high school at a book festival, and everyone bought those comic books or whatever. And I bought this book about viruses. And I think that was the point for me that I diverged, I think. And I kept as a biochemist, but the lab world wasn't that appealing to me. And by mere chance, I got to teach high school just as a substitute, as a favor for a friend. And the science educational world just grabbed me. And I said, yeah, that's better than lab, for me at least.
Yeah, and I had a kind of a similar experience. My lab experience was not going very well in my first year of my master's, so that's why I transitioned to science education, because I found it would be more engaging.
Interesting. So for our young folks out there, you don't have to take a linear path from step to step to step. You can go off the path and explore some area and realize that's not for you, and then pick it up again in a different route.
Absolutely.
Absolutely, indeed.
Well, it doesn't look like we have any questions coming in. So with that, I will thank you both for a really interesting talk. I'm curious to try out the SageModeler for myself now. I put the link in our Facebook chat so people can find SageModeler there. Great. And we have many more Science Festival presentations today, April 17th, going on all the way till 5 o'clock. And then we have more presentations throughout the week through April 30th. So check us out for the complete schedule. Go to sciencefestival.msu.edu. And thank you again for this wonderful presentation.
Thank you very much. Go green.
And go white.
Bye.
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 Bye.